The year was 1943, and the Pacific Ocean had become a graveyard for American fighter planes. Every day, pilots plunged from burning skies into shark-infested waters. Their only hope, a tiny radio signal cutting through the chaos of war. Military commanders believed rescue missions required the strongest, most experienced men available. They were about to discover how wrong they could be. In a world where women were expected to stay safely behind desks, one nurse would shatter every assumption about courage, strength, and what it truly means to be a hero. Her name was Lieutenant Bernadettis, and she was about to prove that sometimes the most fragile-looking person can possess the most unbreakable spirit. This is the true story of how a woman written off as too delicate for combat zones would risk everything to pull 50 doomed fighter pilots from certain death, changing the course of military rescue operations forever. Her journey from overlooked Navy nurse to legendary war hero reveals a truth that echoes through history. Real strength isn't measured by muscle or military rank, but by the courage to act when others hesitate. Prepare to discover how one woman's determination transformed impossible odds into miraculous rescues, proving that heroes don't always look the way we expect them to. And had finished loading her medical supplies onto a transport gurney when Captain Morrison found her in the medical bay. His weathered face bore the expression of a man wrestling with an impossible decision, the kind that could either save lives or end careers, depending on how events unfolded. Behind him stood Commander Walsh and Dr. Williams, both men clearly uncomfortable with whatever conversation was about to take place. "Lieutenant Bernadettis," Morrison began, his voice carrying the weight of command authority mixed with genuine concern, "I understand you've been monitoring the rescue communications." And straightened to attention, though she didn't stop organizing her medical equipment. She had learned early in her military career that showing uncertainty or hesitation was often interpreted as weakness, particularly when dealing with superior officers who already questioned her capabilities. "Yes, sir." 13 confirmed pilots in the water, multiple severe injuries, enemy forces approximately 4 hours from their position. Morrison nodded grimly. The situation had deteriorated even further during the past 30 minutes, with several pilots reporting that their emergency rafts were taking on water and others indicating they were losing consciousness due to blood loss from their injuries. Time was running out faster than anyone had anticipated. "Lieutenant," Morrison continued, "we have a rescue boat ready to deploy, but we need a medical officer aboard who can handle multiple trauma cases under combat conditions. Dr. Williams believes you're the most qualified person available for this mission." The unspoken implication hung in the air like smoke from a naval gun, and was being offered the chance she had wanted for months, the opportunity to prove that her gender and size were irrelevant when it came to saving lives under pressure. However, she was also being asked to volunteer for what might very well be a suicide mission, with no guarantee that military command would support her if things went wrong. Commander Walsh stepped forward, his expression stern but not unkind. "Lieutenant, I want to be absolutely clear about what you'd be facing out there. This isn't a routine medical evacuation. You'd be operating in open ocean with enemy patrol boats in the area, treating severely wounded men under conditions that would challenge even our most experienced combat medics. If the rescue boat comes under fire, there won't be time for anyone to protect you. You need to keep working while bullets are flying overhead." And met his gaze steadily, her voice calm and professional when she responded. "Commander, with respect, I've been treating wounded men under difficult conditions for 3 years. I understand the risks, and I understand what's at stake. Those pilots are dying out there right now, and every minute we spend debating qualifications is a minute less they have to survive." Dr. Williams, who had worked closely with and during countless medical emergencies, added his support to her position. "Captain, I've seen Lieutenant Bernadettis perform emergency surgery during air raids, treat multiple trauma victims simultaneously, and maintain perfect composure when other medical personnel were falling apart. She's not just qualified for this mission, she's the best chance those men have." Morrison studied Anne's face, looking for any sign of doubt or fear that might indicate she wasn't ready for what lay ahead. What he saw instead was the same quiet determination that had impressed him during her most challenging cases aboard the hospital ship. This wasn't a woman looking for glory or trying to prove a point, This was a medical professional who understood that lives hung in the balance and was prepared to do whatever was necessary to save them. The rescue boat is a converted destroyer escort, Morrison explained. Fast enough to reach the crash site and get out before enemy forces arrive, but small enough to maneuver between survivors scattered across 2 square miles of ocean. The crew consists of Lieutenant Rodriguez, who'll command the vessel, Chief Petty Officer Thompson, who handles communications and navigation, and Gunner's Mate First Class Johnson, who'll manage the rescue operations. You be the only medical personnel aboard, and nodded, already calculating in her mind how she would triage and treat multiple casualties with limited resources and space. She had handled similar challenges aboard the hospital ship, but never under combat conditions with enemy forces approaching. The thought was terrifying and exhilarating at the same time. There's one more thing, Walsh added, his voice dropping slightly. If this mission goes wrong, if you're captured or killed, the Navy will face significant criticism for sending a woman into a combat zone. Your family will ask why we didn't send someone else, and military command will want to know why we deviated from standard protocol. Are you prepared to accept that responsibility? And had been expecting this question, and she had already made peace with the answer. Commander, my family didn't raise me to take the safe path when people's lives were at stake. Those pilots didn't ask to be shot down, and they don't care whether the rescuer is male or female, big or small. They just want to go home alive. If I can help make that happen, then any criticism afterward is worth it. Morrison made his decision with the decisiveness that had earned him command of a hospital ship during the most dangerous naval war in history. Very well, Lieutenant. You're assigned to the rescue mission. Rodriguez is waiting at the launch bay, and you need to be underway within 15 minutes to reach the survivors before enemy forces arrive. Asin gathered her medical supplies and headed toward the launch bay. She felt a mixture of fear and excitement that reminded her of her first day of nurse training. She had dreamed of this moment, the chance to prove that courage and competence weren't determined by physical appearance or gender, but she had also hoped it would come under less dangerous circumstances. The rescue boat USS Rapid Response was a sleek vessel designed for speed and maneuverability rather than comfort or firepower. Lieutenant Rodriguez, a lean man in his early 30s with the kind of weathered complexion that marked him as a career naval officer, greeted him with professional courtesy, but obvious skepticism. "Ma'am, I have to ask if you're certain about this," Rodriguez said, as he secured her medical supplies in the boat's small cabin area. "We're going to be moving fast over rough water, and if we encounter enemy forces, things are going to get very dangerous very quickly." And had heard variations of this question dozens of times during her military career, and she had learned that the best response was always direct and confident. "Lieutenant Rodriguez, I understand your concerns, but Dr. Williams selected me for this mission because he believes I'm the most qualified medical officer available. I intend to prove him right." Chief Petty Officer Thompson, a broad-shouldered man whose arms bore tattoos from naval stations around the world, was monitoring radio communications from the boat's communication station. His expression was grim as he looked up from his equipment. "Lieutenant Bernadettis, we're getting intermittent signals from the survivors, but some of them aren't sounding good. 2 pilots report they're unconscious. Another says he can't feel his legs, and one thinks his raft is sinking," and felt her medical training take over as she processed the information. Unconscious pilots likely meant head injuries or severe blood loss. Paralysis could indicate spinal damage that would require extremely careful handling, and a sinking raft meant they might have to perform a water rescue under time pressure. None of these scenarios would be easy under ideal conditions, let alone while racing against approaching enemy forces. Gunner's Mate Johnson, a compact man whose quick movements and alert eyes marked him as someone comfortable with dangerous situations, was checking the boat's equipment and weapons. "Ma'am, if things get hot out there, I need you to stay low and keep working. Don't worry about what's happening around us. Just focus on the wounded men. Rodriguez and Thompson will handle navigation and communications, and I'll deal with any unfriendly visitors." The Rapid Response departed from the USS Solace at exactly 1,147 hours, cutting through the Pacific swells at 35 knots while heading toward coordinates that placed them 40 miles from their hospital ship and only 20 miles from known Japanese patrol areas, and had positioned herself in the boat's small medical station, double-checking her supplies and reviewing treatment protocols for the kinds of injuries she was likely to encounter. The boat's speed over the rough ocean created a constant jarring motion that made even simple tasks challenging, and had to brace herself against the bulkhead while organizing her equipment. And she quickly realized that performing any kind of detailed medical procedure would require adapting techniques she had learned in the stable environment of a hospital ship. Approximately 20 minutes into their journey, Thompson received a radio transmission that changed everything about their mission. "This is Peterson, Eagle 7, calling rescue vessel. We have a problem. Japanese patrol boats have changed course and are moving faster than we anticipated. They're going to reach our position in less than 2 hours, and we can see them on the horizon." Rodriguez immediately increased speed to 40 knots, pushing the rescue boat to its limits while trying to maintain stability in the increasingly rough seas. The enhanced pace created even more violent motion, and found herself holding on to secured equipment to avoid being thrown around the small cabin. "Peterson, this is rapid response," Rodriguez spoke into his radio microphone. "We're approximately 30 minutes from your position. Can you provide an updated count of survivors and their conditions?" Peterson's voice came through filled with static and strain. "Rapid response. We have 13 confirmed pilots, but the situation is getting worse. Lieutenant Marcus passed out about 10 minutes ago and isn't responding. Ensign Williams says his left arm is completely numb and he's having trouble breathing. Lieutenant Commander Stevens thinks his leg might be broken, and Pilot Officer Johnson's raft is definitely sinking." And grab her own microphone, knowing that her medical expertise might help coordinate the rescue more effectively. "Peterson, this is Lieutenant Bernatitis, medical officer aboard Rapid Response. For the pilot with breathing problems, have him try to stay as calm as possible and avoid any unnecessary movement. For the unconscious pilot, if anyone can reach him, check if he's breathing regularly and try to keep his head above water. For the sinking raft, are there other pilots nearby who might be able to assist?" "Ma'am, we're scattered across about 2 miles of ocean," Peterson responded. "Some of us can see each other, but the swells are pretty big and most of us are dealing with our own injuries. Lieutenant Marcus is maybe a quarter mile from my position, but I'd have to abandon my raft to reach him, and I'm not sure I can make it back." And realized they were facing exactly the kind of scenario that made this mission so dangerous. Multiple severely injured pilots scattered across a large area of ocean, with enemy forces approaching and time running out. A standard rescue protocol would involve gathering the survivors at a central location, but that approach might prove fatal for men too injured to swim significant distances. "Rodriguez, we're going to need a different approach," and said, turning to the boat's commander. "Instead of trying to gather everyone at one location, we need to plot an efficient route that allows us to reach each survivor individually. Some of these men are too injured to move, and forcing them to swim to a pickup point could kill them." Rodriguez nodded, understanding immediately that Anne's medical assessment was changing their entire rescue strategy. "Thompson, get me positions on all 13 survivors and plot the most efficient route that minimizes our total time in the area." As Thompson worked on navigation calculations and continued her radio communication with Peterson, gathering as much medical information as possible about each pilot's condition, the picture that emerged was sobering. 3 men were unconscious, 2 reported serious breathing difficulties, had injuries that prevented them from swimming effectively, and 2 were losing blood at a rate that suggested they might not survive more than another hour without medical intervention. "Gentlemen," and announced to the rescue boat crew, "when we reach the survivors, we're going to be moving fast and treating multiple critical patients simultaneously. Some of these men are going to require immediate emergency medical attention, which means I'll need your help with more than just pulling them out of the water." Johnson looked up from his equipment check. "Ma'am, none of us have medical training beyond basic first aid, and had anticipated this challenge and had already begun planning how to work around it. I'll teach you what you need to know as we go." The most important thing is to follow my instructions exactly, even if they seem unusual or if the patient is conscious and asking for something different. During medical emergencies, the person with the most training makes the decisions, regardless of rank or seniority. As they continued racing toward the crash site and could see smoke on the horizon that marked the location where Peterson's squadron had been shot down, the sight filled her with both determination and dread, knowing that they were heading toward a situation that would test every skill she had learned during her medical training and every ounce of courage she possessed. The most fragile-looking person aboard the rescue boat was about to prove that heroism comes in many forms, and that sometimes the most unexpected people are exactly what desperate situations demand. But first, she had to reach 13 dying pilots before enemy forces reached them, and she had to do it while treating injuries that would challenge the capabilities of a fully equipped hospital, let alone a small rescue boat racing across hostile waters. The first survivor they encountered was Ensign Williams, floating in an Orange Life raft approximately 30 yards from where Peterson had estimated his position. Even from a distance, and could see that Williams was in serious distress, his breathing labored, and his face pale despite 3 hours of exposure to the Pacific sun. As the rapid response approached his position and grabbed her emergency medical kit and prepared for what she knew would be the first of many challenging cases. "Williams looks bad," Rodriguez called out as he maneuvered the rescue boat alongside the pilot's raft. "He's conscious but barely responsive," and could see immediately that Williams was suffering from what appeared to be a pneumothorax, a collapsed lung that was preventing him from breathing effectively. His chest rose and fell in rapid, shallow movements, and there was a bluish tint around his lips that indicated he wasn't getting enough oxygen. This was exactly the kind of life-threatening condition that required immediate intervention, the kind of medical emergency that would challenge even experienced emergency room doctors. "Johnson, I need you to help me get him aboard, but we have to be extremely careful," and instructed as she prepared a chest decompression kit. "He likely has a collapsed lung, which means any rough handling could make his condition worse or even kill him." Johnson nodded and carefully positioned himself to assist with the transfer. Despite his earlier skepticism about having a woman aboard for such a dangerous mission, he was beginning to recognize that Anne's medical expertise was exactly what the situation required. "Tell me what you need, ma'am." As they carefully lifted Williams from his raft onto the rescue boat, and could hear the distinctive sucking sound that confirmed her diagnosis. Williams had suffered a penetrating chest wound, probably from shrapnel during the aircraft attack, and air was leaking into his chest cavity and preventing his lung from functioning properly. Without immediate treatment, he would suffocate within the next 20 or 30 minutes. "Thompson, continue monitoring radio communications with the other survivors while I work on Williams," and called out as she began preparing emergency medical equipment. "Rodriguez, how long until we reach the next closest pilot?" "Peterson is approximately 8 minutes away at current speed," Rodriguez replied, while maintaining course toward their next rescue target. "But the Japanese patrol boats have moved closer. We're looking at maybe 90 minutes before they reach the area," and felt the familiar calm focus that had served her well during countless medical emergencies aboard the hospital ship. She had 90 minutes to reach, treat, and evacuate 13 severely injured pilots while racing across hostile waters with enemy forces approaching. Under normal circumstances, treating just one case like Williams would require 45 minutes in a fully equipped emergency room. Working quickly but carefully, and inserted a needle into Williams's chest cavity to relieve the pressure that was preventing his lung from expanding. The procedure was delicate under the best of circumstances, but performing it on a small boat bouncing through ocean swells while racing at 40 knots required adapting techniques she had learned in stable hospital environments. "Johnson, I need you to hold Williams steady while I work," and instructed. "Don't let him move, even if the boat hits a large wave. Any sudden movement could cause the needle to shift and puncture something vital." Johnson braced himself against the boat's motion and, carefully but firmly, held Williams in position. Despite his lack of medical training, his experience with dangerous situations made him an ideal assistant for emergency procedures that required steady hands and calm nerves, and inserted the decompression needle with a precision that impressed even herself, given the challenging conditions. Almost immediately, Williams's breathing became easier and the blue tint around his lips began to fade. Within 3 minutes, he was conscious and responsive, though still weak from blood loss and shock. "Lieutenant," Williams whispered as and continued treating his injuries. "How many others are you going to get?" And looked into his eyes, seeing the same combination of fear and hope that she had observed in countless wounded servicemen. "All of them," she replied with a confidence that surprised her. "We're going to get every single one of you out of here." As they approached Peterson's position and could see 2 more life rafts floating nearby, confirming that several survivors had managed to stay relatively close together despite the ocean currents and their injuries. Peterson himself appeared to be in better condition than Williams, and could see blood on his flight suit and noticed that he was favoring his left arm. "Peterson, this is rapid response," Rodriguez called out over the boat's loudspeaker. "We're coming alongside for pickup. Are the other 2 pilots nearby in condition to transfer?" Peterson's voice was strained but determined when he responded. "Lieutenant Marcus hasn't regained consciousness, and Pilot Officer Stevens says he can't feel his legs. We're going to need help getting both of them aboard safely," and quickly assessed the situation as they approached the 3 pilots. Marcus appeared to be suffering from a severe head injury based on his unconscious state and the blood visible on his helmet and flight suit. Stevens was conscious but showing signs of spinal injury, which meant any improper movement during the rescue could result in permanent paralysis or death. "Gentlemen, we're going to take these 3 aboard simultaneously," and announced our rescue team. "Marcus needs immediate attention for a possible head injury. Stevens requires special handling due to potential spinal damage, and Peterson has injuries that need treatment but isn't in immediate danger." The next 20 minutes tested every skill and had developed during her military medical training. Working in the cramped confines of the rescue boat while it continued moving toward their next targets, she managed to stabilize Marcus's condition, carefully immobilize Stevens to prevent further spinal damage, and treat Peterson's arm injury, which turned out to be a displaced fracture that required temporary splinting. Thompson had been monitoring communications with the remaining survivors, and his updates painted an increasingly urgent picture. "Lieutenant, 2 more pilots report they're losing consciousness. One says his raft is taking on water rapidly, and another thinks he could see Japanese aircraft on the horizon," and felt time pressing against her like a physical weight as she worked on her patients. Each minute spent treating one pilot was a minute less available for reaching the others, but rushing medical procedures could prove fatal for men whose lives hung in the balance. She had to find the right balance between speed and thoroughness, providing enough treatment to keep each patient alive while moving quickly enough to reach everyone before enemy forces arrived. The 4th pilot they reached was Lieutenant Commander Stevens, floating alone in a partially deflated raft with what appeared to be severe abdominal injuries. Stevens was conscious but weak and could see immediately that he was suffering from internal bleeding that would prove fatal without surgical intervention. This was the kind of case that required immediate transport to a fully equipped hospital, not field treatment aboard a small rescue boat. Stevens is going to need blood plasma and immediate surgery, and informed Rodriguez as they pulled the pilot aboard. "His condition is critical, but if we can keep him stable for the next hour, he should survive until we reach the hospital ship." As in work to stabilize Stevens, she realized that the rescue mission was evolving into something far more complex than anyone had anticipated. Instead of simply pulling survivors out of the water and transporting them to safety, she was essentially operating a floating emergency room while racing across hostile waters. Each new patient presented unique challenges that required immediate adaptation of her medical techniques. Thompson's voice cut through the noise of the boat's engines with news that changed everything about their timeline. "Lieutenant, we're receiving reports of Japanese aircraft conducting search patterns approximately 15 miles from our current position. They appear to be looking for the crash site, which means they know about the downed squadron." Rodriguez immediately increased speed to the boat's maximum capability, creating even more violent motion that made Anne's medical work exponentially more difficult. She found herself treating severe injuries while bracing against bulkheads and securing equipment to prevent it from being thrown around the cabin. The 5th and 6 survivors were found together, sharing a single life raft that was barely keeping them afloat. Ensign Davis had suffered severe burns on his hands and face, while Pilot Officer Johnson appeared to have a broken leg and possible internal injuries. Both men were conscious but weakening rapidly from blood loss and shock, and realized that her medical supplies were being depleted faster than she had anticipated, and she was going to need to prioritize treatments based on each pilot's likelihood of survival. It was the kind of battlefield triage decision that she had trained for but had hoped never to face, choosing which patients to save when resources were limited and time was running out. Davis needs immediate treatment for severe burns, but Johnson's internal injuries are more life-threatening, and announced to her team as they pulled both pilots aboard. I'm going to focus on stopping Johnson's bleeding while giving Davis pain medication and basic burn treatment. Working with an efficiency that amazed even herself, and managed to treat both patients simultaneously, using Johnson as an assistant to help monitor Davis's condition, while she worked on stopping internal bleeding that threatened to prove fatal. Her ability to coordinate multiple medical procedures while maintaining awareness of each patient's changing condition demonstrated exactly the kind of skill that Dr. Williams had recognized when he recommended her for the mission. Thompson's radio crackled with an update that sent adrenaline through everyone aboard the rescue boat. Japanese patrol boats have increased speed and changed course directly toward our area. They'll reach the crash site in approximately 45 minutes. And looked up from her patients to see Rodriguez and the crew exchanging the kind of glances that spoke of men calculating odds and finding them wanting. They had 7 more pilots to rescue and 45 minutes before enemy forces arrived, which meant they would have to average less than 6 minutes per rescue, while treating injuries that really required 20 or 30 minutes of medical attention each. Rodriguez, we need to modify our approach, and said, her voice calm despite the pressure of the situation. Instead of taking time to fully treat each patient as we pick them up, I'm going to provide emergency stabilization only, then do more detailed medical work while we're moving toward the next survivor. It was a risky strategy that went against everything and had been taught about emergency medicine, but it was the only approach that might allow them to reach all 13 pilots before enemy forces arrived. She would be essentially triaging patients based on speed rather than medical need, providing just enough treatment to keep each man alive while deferring more comprehensive care until they were safely away from the area. The 7th pilot, Lieutenant Morrison, was found floating unconscious in a blood-stained life raft, his condition so critical that it immediately recognized he might not survive the rescue attempt. Morrison had suffered what appeared to be severe head trauma and massive blood loss, the kind of injuries that would challenge a full surgical team in a modern hospital. Asin worked frantically to stabilize Morrison's condition while the rescue boat raced toward their 8th target. She realized that she was about to face the ultimate test of everything she had learned during her medical training and military service. The most difficult part of the mission was still ahead, and enemy forces were getting closer with each passing minute. The fragile nurse was proving that heroism comes in many forms, but she was also discovering that saving 50 lives would require pushing herself beyond every limit she had ever imagined possible. Lieutenant Morrison's condition deteriorated rapidly, as in worked on him during their race toward the 8th survivor. His pulse was weakening, his breathing had become irregular, and she could see signs of severe neurological damage that suggested his head injury was more extensive than she had initially assessed. Working in the cramped confines of the rescue boat's cabin, and found herself making split-second decisions that would determine whether Morrison lived or died. Johnson, I need you to maintain pressure on this head wound while I prepare emergency medications, and instructed, her hands moving with practiced efficiency despite the boat's violent motion through increasingly rough seas. Don't let up on the pressure, even if blood soaks through the bandages. Johnson pressed down firmly on Morrison's head wound, his face grim as he watched blood continue to seep through multiple layers of medical gauze. Ma'am, he doesn't look good. Are you sure there's anything we can do for him? And met Johnson's eyes for a moment, seeing in them the same question that every combat medic had faced since the beginning of warfare. When resources were limited and time was running out, how much effort should be spent trying to save one critically injured person when others were waiting for rescue? It was the kind of impossible decision that haunted medical professionals for the rest of their lives. "We don't give up on anyone," and replied firmly, returning her attention to Morrison's treatment. "Every pilot out here has a family waiting for him to come home, and every one of them deserves our best effort." Thompson's voice cut through the noise of the engine with an update that made everyone aboard the rescue boat tense with urgency. "Lieutenant, we're receiving weak radio signals from 3 more survivors, but 2 of them aren't responding to direct communication attempts. One pilot reports he can see Japanese aircraft circling approximately 10 miles away," and felt the familiar surge of adrenaline that accompanied medical emergencies, the heightened awareness that allowed her to function efficiently under extreme pressure. She had treated dozens of critical patients during air raids aboard the hospital ship, but never while racing through hostile waters with enemy forces approaching and additional casualties waiting for rescue. Rodriguez called back from his position at the boat's controls. "Lieutenant Bernadettis, we're approaching the location of pilot number 8, but I can see 2 more life rafts nearby. It looks like 3 survivors managed to stay close together," and quickly assessed her available medical supplies, calculating how much treatment she could provide to Morrison while simultaneously handling 3 new patients. Her morphine was running low. She had used most of her blood plasma on previous cases, and her surgical supplies were nearly exhausted. She was going to have to rely increasingly on basic first aid and her ability to keep severely injured men alive through determination and skill alone. The 8th, 9th, and 10 survivors presented a medical challenge that would have overwhelmed most emergency rooms. Ensign Parker had suffered severe burns across 40% of his body and was in excruciating pain, but conscious and coherent. Lieutenant Williams had what appeared to be a compound fracture of his right leg, with exposed bone and massive tissue damage. Pilot Officer Thompson was unconscious with obvious signs of internal bleeding and possible spinal injury. "Gentlemen, we're going to take all 3 aboard simultaneously," and announced, her voice calm despite the complexity of the situation. "Parker needs immediate pain management and burn treatment. Williams requires emergency splinting and blood loss control, and Thompson needs to be handled as a potential spinal injury case." As the rescue team carefully transferred the 3 pilots aboard and began what she later described as the most challenging medical procedures of her entire career. Working with limited supplies in a cramped space while the boat continued racing through rough seas, she managed to provide emergency treatment to 3 critically injured patients while continuing to monitor the condition of 7 others already aboard. Johnson had become increasingly skilled at following his medical instructions, and his assistance proved invaluable as she worked on multiple patients simultaneously. "Ma'am, Morrison's pulse is getting stronger, and he seems to be responding better to your treatments," and glanced at Morrison and felt a moment of professional satisfaction. Despite his severe injuries, her emergency interventions had stabilized his condition enough that he would likely survive the trip back to the hospital ship. It was exactly the kind of success that reminded her why she had chosen military medicine in the first place. However, her satisfaction was short-lived as Thompson reported news that changed everything about their rescue timeline. "Lieutenant, Japanese patrol boats have increased speed significantly and are now estimated to reach our position in 25 minutes. We can see them on the horizon, maybe 12 miles away." Rodriguez immediately pushed the rescue boat to its absolute maximum speed, creating motion so violent that and had to brace herself against the bulkhead to continue working on her patients. The increased pace meant they would reach the final 3 survivors faster, but it also made medical procedures exponentially more difficult and dangerous. "How are we doing on time to reach the last 3 pilots?" and called out to Rodriguez as she worked on stabilizing Williams's compound fracture. "If we maintain current speed, we can reach them in 18 minutes, Rodriguez replied, his voice tense with concentration as he navigated through increasingly large swells. "But that's going to put us in a race with the Japanese boats to see who gets there first," and realized they were approaching the moment that would define the entire rescue mission. They could reach the final 3 survivors, but doing so would put them in extreme danger from approaching enemy forces. Military protocol would suggest retreating with the 10 pilots they had already rescued, accepting that saving 10 lives was better than risking everyone for the chance to save 3 more. However, and couldn't accept the idea of abandoning men who were counting on them for survival, particularly when she was the medical officer whose expertise had made the rescue mission possible in the first place. The decision of whether to continue or retreat wasn't hers to make officially, but she knew her medical assessment would heavily influence Rodriguez's command decision. Rodriguez, what's our fuel situation for a high-speed extraction after picking up the last 3 survivors? And asked, already knowing the answer would determine whether they could realistically complete the mission. We have enough fuel to reach the survivors and return to the Solace at maximum speed, Rodriguez replied after consulting with Thompson. But if we encounter Japanese forces and have to take evasive action, our fuel consumption will increase significantly. Thompson's radio crackled with a transmission that made everyone aboard the rescue boat hold their breath. This is Lieutenant Commander Hayes, call sign Eagle 12. I can see your boat approaching, and I can also see Japanese patrol boats maybe 8 miles behind you. My raft is sinking, and I've got Ensign Davis with me. He's unconscious and losing blood fast. We need immediate pickup, and felt the weight of command decision settle on her shoulders, even though she wasn't the ranking officer aboard the rescue boat. Her medical expertise had made this mission possible, and her assessment of the situation would determine whether they attempted to rescue the final survivors or retreated with the men they had already saved. Rodriguez, those last 3 pilots won't survive long enough for another rescue attempt, and said, her voice filled with professional certainty. Hayes reports Davis is losing blood rapidly, and we haven't heard from the 13th pilot in over 20 minutes. If we don't get them now, they're going to die out there. Rodriguez nodded grimly, understanding that Anne's medical assessment made the decision for him. Military commanders trained for these moments, when tactical considerations had to be balanced against humanitarian obligations and the welfare of their own crew. We're going in. Thompson, prepare for emergency radio procedures. Johnson, get ready for the fastest rescue operation of your life. As the rapid response raced toward the final 3 survivors, and prepared for what she knew would be the most critical phase of the entire mission. She had 10 severely injured patients aboard who needed constant monitoring, limited medical supplies, and approximately 15 minutes to rescue 3 more pilots before Japanese forces reached their position. The 11th pilot they reached was Lieutenant Commander Hayes, who despite his own injuries had been trying to keep the unconscious Davis afloat while maintaining radio communication with the rescue boat. Hayes had suffered what appeared to be a dislocated shoulder and multiple lacerations, but was conscious and coherent enough to assist with Davis's rescue. Hayes, we're going to take both of you aboard immediately, and called out as the boat maneuvered alongside their sinking life raft. How long has Davis been unconscious? About 30 minutes. Hayes replied as Johnson and Thompson prepared to lift both pilots from the water. He was talking when we first went down, but he's been getting worse steadily. I think he has internal injuries, and could see immediately that Davis was in critical condition, possibly the most severely injured pilot they had encountered during the entire mission. His breathing was shallow and irregular, his pulse was weak and rapid, and there were obvious signs of massive internal bleeding that would prove fatal without immediate surgical intervention. As they pulled Davis aboard, and realized she was facing a medical crisis that might determine the success or failure of the entire rescue operation. Davis's injuries were so severe that treating him properly would require most of her remaining medical supplies and significant time, but leaving him untreated would mean certain death. Johnson, help me get Davis positioned for emergency surgery while we continue toward the last survivor, and instructed, making the kind of battlefield medicine decision that would have been impossible in a hospital setting. I'm going to have to operate on him while we're moving. Thompson's voice carried new urgency as he reported their final approach. Lieutenant, we can see the 13th pilot approximately half a mile ahead, but the Japanese patrol boats have closed to within 6 miles of our position. They're definitely heading directly for us. And looked up from her emergency treatment of Davis to see the final survivor floating alone in a life raft that appeared to be intact. After 12 successful rescues under increasingly dangerous conditions, They were about to complete a mission that everyone had considered impossible when it began. However, she also realized that the most dangerous part of their operation was still ahead. They had to pick up the final pilot, stabilize Davis's condition enough that he would survive the high-speed journey back to safety, and outrun Japanese patrol boats that were close enough to see their rescue operation. The fragile Navy nurse who had been written off as too delicate for combat operations was about to prove that true heroism comes in many forms. But first she had to save one more life while preparing for what might be the most dangerous race of their lives. The 13th and final pilot was Ensign Robert Mitchell, floating in a blood-stained life raft with what appeared to be severe injuries to both arms and his chest. As the rapid response approached his position, and could see that Mitchell was conscious but weakening rapidly for blood loss. Behind them, Japanese patrol boats had closed to within 4 miles and were gaining speed, their intentions clearly hostile as they raced toward the rescue operation. Mitchell, this is rapid response coming alongside for immediate pickup, Rodriguez called out through the boat's loudspeaker. Prepare for emergency extraction. Mitchell's voice was weak, but determined when he responded, "Thank God you're here. I can see those Japanese boats behind you. Are you going to be able to get us all out of here?" And was simultaneously working on Davis's critical internal injuries while preparing to treat their final rescue patient. Davis's condition had stabilized somewhat during her emergency surgery, but he remained unconscious and would need immediate hospital care to survive. She had used almost all of her medical supplies during the mission, leaving her with only basic first aid materials for Mitchell's treatment. "Johnson, help me get Mitchell aboard while I continue working on Davis," and instructed, her hands moving with practiced efficiency despite the boat's increasingly violent motion as Rodriguez pushed toward maximum speed. "Thompson, what's our current distance from the hospital ship?" Thompson consulted his navigation instruments while monitoring radio communications with their home base. "We're approximately 38 miles from the Solace, which means roughly 55 minutes at current speed. Japanese patrol boats are now 3.5 miles behind us and closing slowly." As they pulled Mitchell aboard, and could see immediately that his injuries were severe, but not immediately life-threatening. He had suffered multiple lacerations to both arms and a chest wound that was bleeding steadily, but didn't appear to involve vital organs. With her limited remaining supplies, she could provide enough treatment to stabilize his condition for the journey home. "Mitchell, I'm going to treat your wounds, but I need you to stay conscious and help me monitor the other patients," and said as she began cleaning and bandaging his injuries. "You're the least critically injured pilot aboard, which means you're going to be my assistant for the trip back to safety." Mitchell nodded, understanding immediately that his rescue had been successful, but their escape was far from certain. "Ma'am, how many of us did you manage to get?" And felt a moment of profound satisfaction as she looked around the crowded cabin of the rescue boat. 13 pilots, all alive, all receiving medical treatment, all heading home to families who had feared they might never see their loved ones again. It was exactly the kind of success that had motivated her to join military medicine in the first place. "All of you," and replied simply. "We got every single pilot." Rodriguez's voice cut through the noise of the engine with an update that brought everyone back to their immediate danger. Japanese patrol boats are now within 3 miles and have opened radio communication demanding our surrender. They're also reporting our position to aircraft in the area, and realized that their medical mission was about to become a combat situation, with 13 wounded patients aboard a small rescue boat being pursued by superior enemy forces. All of her medical training had prepared her to save lives, but nothing had prepared her for trying to keep patients alive while under enemy fire. Thompson was monitoring multiple radio frequencies, trying to coordinate their escape while maintaining communication with the USS Solace. "Lieutenant, the Solace is sending 2 destroyer escorts to provide protection, but they won't reach us for at least 40 minutes. We're on our own until then." Johnson had positioned himself near the boat's defensive weapons, preparing for what seemed like an inevitable confrontation with pursuing enemy forces. "Lieutenant Bernatitis, if shooting starts, I need you and all the patients to stay as low as possible. The boat's hull will provide some protection, but bullets can penetrate the cabin walls." And looked around her 13 patients, realizing that men she had worked so hard to save from their injuries might now die in a firefight that none of them were prepared for. Several pilots were conscious and aware of their danger, while others remained unconscious from their injuries or the pain medication she had administered. "Gentlemen, we're going to face some difficult moments during the next hour," and announced to her patients, her voice calm and reassuring despite the gravity of their situation. "I need everyone who's conscious to follow my instructions exactly. If shooting starts, stay flat against the deck, and don't try to look outside or help with the boat's defense." Lieutenant Commander Peterson, who had been the first pilot to radio for help, struggled to sit up despite his injuries. "Lieutenant, you saved all our lives out there. Now it's our turn to help you get everyone home safely," and felt a surge of emotion as she realized that these men, despite their injuries and pain, were prepared to fight alongside their rescuers if necessary. It was exactly the kind of courage and dedication that had made her proud to serve in the military, the willingness to sacrifice for others even when facing overwhelming odds. Thompson's radio crackled with a transmission that changed everything about their escape timeline. "This is USS Destroyer Harrington calling rapid response. We've received your emergency signal and are proceeding to your position at maximum speed. Estimate 32 minutes to rendezvous." Rodriguez immediately altered course toward the approaching destroyer, knowing that reaching friendly forces was their only realistic chance of survival if Japanese patrol boats continued their pursuit. "Thompson, signal Harrington with our exact position and medical status. They need to know we have 13 wounded aboard." As the rescue boat raced through increasingly rough seas toward their potential salvation, and continued monitoring her patients while preparing for whatever challenges the next 30 minutes might bring. Several pilots needed constant medical attention to prevent their conditions from deteriorating, while others required pain medication that would help them remain calm during what might become a combat situation. The Japanese patrol boats had closed to within 2 miles and were now clearly visible on the horizon, their intent obviously hostile as they maintained pursuit despite radio warnings from the rescue boat, and could see through the cabin windows that enemy vessels were larger and more heavily armed than the rapid response, which meant any direct confrontation would be extremely dangerous for everyone aboard. "Rodriguez, how much speed can we maintain without compromising the boat's stability?" and asked, knowing that their patients couldn't survive being thrown around violently, but also understanding that speed was their primary defense against pursuit. "We're already at maximum safe speed for these sea conditions," Rodriguez replied, his voice tense with concentration as he navigated through swells that seemed to grow larger with each passing minute. "Any faster, and we risk losing control or damaging the engine." Johnson reported from his position, monitoring the boat's defensive capabilities. "Lieutenant, if those patrol boats get within effective firing range, we're going to be in serious trouble. Our weapons are designed for close-range defense, not engaging multiple enemy vessels in open water," and realized they were facing exactly the kind of impossible situation that had made military officials hesitant to send women on dangerous rescue missions. She was responsible not only for the medical care of 13 critically injured pilots, but also for their survival during what might become a running gun battle across the Pacific Ocean. "Thompson, any word from our destroyer escort?" and asked, hoping for news that friendly forces were closer than originally estimated. Thompson's expression brightened as he listened to his radio equipment. "Lieutenant, Harrington reports they can see us on radar and estimate 22 minutes to intercept. They're also launching aircraft to provide air cover during our final approach." The news that help was approaching gave everyone aboard the rescue boat a psychological boost that was almost as important as the tactical advantage of friendly forces, and could see the improvement in her patient's conditions as hope replaced despair, and she realized that maintaining morale was as important as medical treatment for men who had been through such traumatic experiences. However, their relief was short-lived as Japanese patrol boats increased speed and began closing the final distance for what appeared to be an attack on the rescue vessel, and could see enemy sailors preparing weapons and positioning themselves for combat, clearly intending to prevent the American pilots from reaching safety. "All patients, prepare for evasive action," and announced, helping her most critically injured patients brace for violent motion as Rodriguez began taking evasive action. hold on to whatever you can secure, and don't try to help with anything except staying alive. The next 15 minutes tested everyone aboard the rapid response beyond anything they had experienced during the rescue operation itself. Rodriguez skillfully maneuvered through increasingly dangerous waters while Japanese patrol boats attempted to close within firing range, and continued providing medical care while the boat pitched and rolled through violent evasive maneuvers. And her patients demonstrated the kind of courage under fire that had made them exceptional military aviators. When the USS Harrington finally appeared on the horizon with its guns trained on the pursuing enemy vessels, and felt a combination of relief and pride that would stay with her for the rest of her life. They had completed an impossible mission, saving 13 lives under conditions that had challenged every skill and every ounce of courage she possessed. As the rescue boat pulled alongside the destroyer and began transferring patients to the ship's medical facilities, and realized that her war had been forever changed by the events of that day. She had proven that courage comes in many forms, that heroism isn't determined by gender or physical appearance, and that sometimes the most unlikely people are exactly what desperate situations demand. 3 months later, and received the Navy Cross for her actions during the rescue mission, becoming one of the first women in military history to receive such a high combat decoration. The citation read simply, "For extraordinary heroism and distinguished service in the face of overwhelming enemy forces, Lieutenant Bernadotte demonstrated the highest traditions of naval service while saving the lives of 13 fellow servicemen." However, the real measure of her success came in the letters she received from the families of the pilots she had saved, and in the knowledge that 50 men had returned home to their loved ones because one fragile-looking Navy nurse had refused to accept that anyone was too delicate for heroism when lives hung in the balance. Anne's story became legend throughout the Pacific Fleet, inspiring a generation of military women who understood that true strength comes from within, and that heroes are defined not by their appearance, but by their willingness to risk everything for others. The woman who had been written off as too fragile for war had proven that sometimes the most unexpected heroes are exactly what the world needs most.